So in this video, we're going to talk about doing the anterior stress test of the lumbar spine. And so for this video, the patient will be inside lying, but I'm just going to show you on the skeleton where my hands are going to be. So I'm going to be blocking one of the vertebrae from above, and then I'm going to be using my legs to put pressure from the pelvis below, and that's going to cause a relative shear. So it's called an anterior shear because the segment that I'm interested in is the one that I'm blocking, and it's moving anterior in relation to the rest of the body. So I'll have the patient lay on their side facing you. And so you want the knees flexed to about 70 degrees. Come towards me to where you feel my fist on your stomach. Good. I'm going to lower the table down a smidge. And so we don't need to worry about locking or anything in this position, but what you're going to want to do, I like to loop my hand underneath the patient's arms. That way I know I have control over their torso. I'm going to come onto skin. And I'm going to come a little bit higher on Juliana because I know her low back. We don't want to irritate anything there. And so let's say that I'm around probably L2 right now. I'm going to flex her knees up to where I feel this space want to open between L2 and L3. And then I'm going to block L2 with my fingers. And then I'm going to shear with my hip on her knees in this direction through her pelvis while I'm blocking L2. And ideally, we don't want to have a lot of movement. So one finger's feeling L2, one finger's feeling L3. I'm going to shear. I don't want to feel L3 come into my fingers. If I do, I can then have the patient abdominally brace for me, and then I can retest and see if she tests stronger. If she does, that means she has the active ability to stabilize through her core to help protect her low back. If she doesn't, this might be someone that needs a brace just in the short term while you build up some stability around that joint for if they're doing things like gardening or something like that. So it's just a nice test to confirm which segment you think has some instability in, and then see if they're able to stabilize that segment.